Welcome back to the NHSC site application process. Today, I'm going to discuss comprehensive primary behavioral health services. As always, everything can be found on the HRSA website under the National Health Service Corps section, and everything I reference can be found in the NHSC site reference guide. So comprehensive primary behavioral health services, these is facilities offering these services and must be located in this site and serve their mental health designated HPSA. So your behavioral health service site should provide core comprehensive behavioral health services on site, so which should include screening and assessment, treatment plan, and care coordination. There's also non-core comprehensive behavioral health services. These can be either on-site, in-network, or off-site through referral, affiliation, or contract. These include diagnosis, therapeutic services, crisis/emergency services, consultative services, and case management. So individuals or sites, I should say, for these comprehensive primary behavioral health services. So we go back to the core comprehensive ones. So if your organization or site that you are applying for does not offer those three core sites, then do not fill out the primary behavioral health services section. So if you do offer all three, then of course can fill out the behavioral health services. But if you do not offer all three core comprehensive, then your site will not be for a mental health HPSA. You do not need to fill out this section then, but just an FYI. So your site must provide at least one of the following services provided on site if you're, core and non-core services. So if your site is going through with these behavioral health services, filling out this section of the application, this is what also must need provided with the application. So either an operating certificate issued by the state, territory, county, etc., or a site brochure listing the behavioral health services, or site policy that outlines the behavioral health services, or a document that includes the website link and screenshot of available behavioral health services, or any other documentation that outlines behavioral health services provided on site. So for the non-core options, though, if your site's providing at least any of those non-core services off-site or out of network, then one of these documents must be submitted. So affiliation agreements, memorandums of understanding or agreement, contracts, letters of referral, letters of support or commitment, and or referral and follow-up policy and procedures. So this is what it's going to look like, these core comprehensive behavioral health service elements that we're going to discuss first. So again, it goes back to that if your organization or site has the screening, assessment, treatment plan, and care coordination services. If you have all three, then you would check the box there. Only, again, fill this out if your organization offers only the core comprehensive behavioral health services. If it cannot, if you don't have all three, let's say you don't do care coordination, your site doesn't do care coordination, then don't fill this section out at all. Moving on to section 2, this would be the non-core elements. So diagnosis, therapeutic services, crisis emergency services, consultative services, and case management. So each one has a description of each. So you would check, if you're continuing on with this document, provide on site or is it provided off site? And you just check. And again, making sure you check, even if it's, again, off site or don't offer it, you got to check provided off site then too. So making sure you have all those boxes checked if you are offering some non-core services or not. So then the section 3 is going to really discuss, okay, where are these off-site services offered? So you have to submit a provider, their address, and what are the services offered. So if we go back to that, let's say you don't do crisis emergency services, your site does not do that. You would put, the provider you have the affiliation or agreement with, that address, and then say, crisis emergency services are offered here. So you can do that for, each one that is offsite, each element. And then certification of compliance with behavioral health, clinical practice requirements. So this is just discussing, you're provided on site, full-time option or a half-time option. So some of those behavioral health, might be only part-time, 20 hours to 30 hours a week. So that would be, you would say you would provide, that on site, or the full-time option on site, or it's not provided on site at all. And then site verification. So you fill that out. The administrator signs that, and that is the behavioral health services. So again, having that documentation and filling this all out, if you do offer behavioral health services, especially all three of those core elements, if you do not need to fill this out. So who's exempt from submitting this? So FQHCs, FQHC lookalikes, Indian Health Service facilities, federal and state prisons, ICE facilities, and then Substance Abuse and Mental Health Services Administration certified opioid treatment programs do not need to submit this documentation or any documents with the behavioral health services. But if your facility does not fall under that, you would need to fill it out again, only if you do offer those three core non-service types elements. If you do not, then you will not need to fill it out. But then you cannot recruit, just as an understanding, you cannot recruit behavioral health occupations that qualify for the NHSC loan repayment program. You would not be a designated mental health HPSA for that facility. So just a little FYI again with that. And if you have any other questions, feel free to email me.